I'm going to explain to you how and why to use a positive end expiratory pressure or PEEP valve with your bag mask device. Positive end expiratory pressure or PEEP is the positive pressure that will remain in the airways at the end of the respiratory cycle, or end of exhalation. PEEP is a value that can be set on a ventilator, but it can also be used with manual ventilation with a bag mask device. During normal respiration, the body has what is referred to as physiologic PEEP. The result in the lungs is that PEEP maintains a small amount of pressure in the alveoli to keep them from collapsing. Normal respiratory physiology works as a negative pressure system. When the diaphragm contracts, or pushes down, negative pressure in the pleural cavity is generated, creating negative pressure in the airways that suck air into the lungs. This negative intrathoracic pressure decreases the right atrial pressure and generates a sucking effect on the inferior vena cava, increasing venous return. When a patient doesn't have spontaneous respirations or they are intubated, intrinsic PEEP is lost. The application of extrinsic PEEP changes the normal respiratory physiology. The positive pressure generated by the ventilations creates positive pressure, or at least less negative pressure, in the thoracic cavity. This increases right atrial pressure and decreases venous return, generating a decrease in preload, or the amount of blood available to the right atrium. Less blood decreases cardiac output. When applying extrinsic PEEP with a patient not intubated, it's vital to make sure the conditions are as favorable as possible. This includes proper patient positioning, use of an oropharyngeal airway, and a proper mask seal. It's advisable to use the two-person technique with one person holding the mask with both hands and the second person providing the ventilations. Our BVMs are not purchased with PEEP valves. However, we purchase PEEP valves separately. The PEEP valve is individually packaged and disposable after each patient use. The PEEP valve is installed on the BVM at the end, near the mask. A plastic cover is removed and the PEEP valve is inserted in its place. Once the PEEP valve is attached to the BVM, the PEEP is set by rotating the red end cap clockwise to increase PEEP and counterclockwise to decrease PEEP. The PEEP valve has settings for 5, 10, 15, and 20 centimeters of water. Normal physiologic PEEP is 3 to 5 centimeters of water. For certain situations, such as acute respiratory distress syndrome or ARDS, PEEP may need to be increased. If you have any questions, feel free to contact Mike Hunter or your supervisor or team lead.